I'm Stephanie Chan, Deputy Director at the Massachusetts Coalition for Serious Illness Care. And as outlined in our goals, we are committed to supporting partnerships that improve communication, connection, and collaboration. So I want to give you updates on 4 of our partnerships that are in progress. But before I do that, I want to say thank you to the many people who volunteer countless hours with the Coalition. We're staffed by a handful of part-timers like myself, so we couldn't do this work without all of you as volunteers. We thank you for responding to our emails. We thank you for joining Zoom calls. And most of all, we hear you when you tell us what it's really like from your perspective. Thank you for sharing. Now on to the updates. Our Massachusetts Medical Schools Collaborative, led by Jen Reedy at UMass Chan Medical School, has been cooking with fire. We recently published a paper about the origin story of the collaborative. And did you see that? My name is next to Atul Gawande. That's pretty cool. But what's really exciting is that we've seen movement at all 4 medical schools when it comes to curricular change. For example, one school has a new required clinical immersion experience for first-year students. All students spend half a day seeing patients with the palliative care team. Another school has added simulation practice in breaking difficult news for all third-year students. It lowers the stakes by using patient actors and gives an opportunity for students to practice difficult conversations. The key progress here is in requiring content for all medical students. We heard loud and clear from them that being skilled in advanced communication is needed by every physician, regardless of specialty. So up next, we're looking forward to faculty development and accelerating even more curricular change at each of the schools. But if corralling faculty from 4 medical schools seemed a bit daunting, we've been working with faculty from the over 25 colleges and schools of nursing in partnership with the Massachusetts Association for Colleges of Nursing. We've got a nursing task force that's co-chaired by Susan Lysat-Hurley from Care Dimensions and Priscilla Gazarian from UMass Boston. We've conducted curriculum mapping to understand where our state's baccalaureate nursing programs stand with serious illness care. These results were recently presented by Anne-Marie Barron at the McGill International Congress on Palliative Care and by Connie Dolan at the Hospice and Palliative Care Federation of Massachusetts. And on top of that, we're currently live with a similar survey out to the 20 graduate level nursing programs. We're hoping for a good response rate. But what's most exciting is a new resources website that just launched. In response to numerous requests from nursing faculty, we vetted and compiled a list of resources that you can incorporate into your teaching materials about serious illness care. And I know many of you are eager to hear about our work supporting the state's transition from MOLST to POLST. We continue to play a key role advising our colleagues at the Executive Office of Elder Affairs. It hasn't gone quite as quickly or as smoothly as we all wish. We ended up needing legislation to authorize this work, but it is most certainly going. A huge thank you to Secretary Elizabeth Chen, Catherine Downs, and the rest of the team at EOEA for their leadership and commitment to leading this complex and important evolution to the nationally recognized POLST program. Thanks to Eric Frummy and Ellen DePaula, co-chairs of our MOLST to POLST advisory group, and to Jane Kavanaugh, who's leading this work. We also want to recognize the many people who provided invaluable expertise and guidance as part of the MOLST to POLST advisory group. So as always, write to us with questions and we will share details whenever they come. And lastly, I want to talk about one of our newest initiatives, the Healthcare Agent Matching Program. It's a beautiful organic partnership with Beth Israel Deaconess Medical Center, Commonwealth Care Alliance, and Blue Cross Blue Shield of Massachusetts. From the Coalition's 2018 research, we learned that 40% of people who didn't have a healthcare agent said it was because they didn't have anyone to choose. So this program is designed to test a concept of matching patients without someone to name with volunteers from the partner organizations who are willing to become their healthcare agents. A big shout out to David Sontag, Amy Hudspeth-Cavell, Wayne Saltzman, and Michelle Durar, who've been instrumental in getting this program off the ground through their organizations. But hold up, we're not ready to take new patients or volunteers outside of the initial organizations yet. Stay tuned though, because we do hope to expand in the future. And while many of you may know me and Anna as Coalition staff, we work alongside a wonderful team of part-timers, including Diana Raya, Zuleika Hernandez, Yemi Hailemariam, Zamawa Arenas, Jane Kavanaugh, and Karine Davila. We are a small and mighty team, and again, none of our work would be possible without your partnership. So truly, thank you.